The Interventions Program is pleased to bring you Eclipse webisode, part 1 of 6. Through this program, we hope to share some useful information and nursing tips with our fellow bone health counselors. Hey there, I'm Zoe. I've been floor manager in this clinic for just over 7 years. What I love the most is helping others, whether it be my colleagues or my patients. In fact, the two usually go hand in hand. For example, just last week, one of our younger nurses told me about a patient with prostate cancer who casually mentioned how he pulled a muscle in his back while playing with his grandkids. I quickly reminded her that pain is often a principal symptom of bone mets, and I advised her to hurry back into the room and ask some open-ended questions, such as, around when did you start feeling this pain? At what time of the day do you feel it the most? Describe the pain to me. Consistent with the symptoms of bone metastases, the patient said he wasn't exactly sure when the pain began, but that it's always there now, and that it feels like a deep, boring sensation. So we notified the attending physician, who immediately ordered imaging tests to look for bone involvement. To help this nurse prepare for the patient's questions, I suggested she review some data online at the Virtual Oncology Center. This was especially helpful after we read the scan. It turned out that the patient did have bone mets, so we discussed the risks and benefits of treatment with Zometa. Then, after checking his baseline creatinine clearance and sending him for a visit with the dentist, he was started on Zometa, 4 milligrams, infused over no less than 15 minutes every 3 weeks. Since we are on the front lines with patients, it is important for nurses to pay close attention to how patients describe their symptoms. By remaining vigilant and asking the right questions, we may be able to identify bone mets earlier so that patients can receive appropriate treatment sooner and possibly delay or reduce skeletal events. We hope you found this Eclipse webisode, brought to you by Novartis Oncology and the Interventions Program, to be helpful and informative. If you'd like to share this story with another nurse, simply click on the email page button above. And if you're not already a member of Interventions and would like to receive the next webisode, sign up now by clicking the membership link at the top of the page. Please see Zometa, zoldronic acid, injection important safety information, and full prescribing information available on this page.